I'm a licensed pharmacist in 3 states, and today we're going to be looking at Aldi's medications. Look at all these medications. I'm pretty sure I'm the first person ever to make that joke. Alright, the one I'm going to talk about today, I have a lot to say about, so this is going to take a while. So this is Omeprazole. It's used for heartburn. It's something called a proton pump inhibitor. And the way it works is it basically just stops your stomach from secreting as much acid. It's $4.99 for 14 tablets, which 35 cents each. That's not really the best deal, but it's competitive. You know, if you Google it, you'll find similar pricing. The brand name for this, by the way, is Prilosec. What's really neat about this medication is that it used to be prescription only, and the manufacturers of the medication appealed to the FDA and got it approved to be sold over the counter without a prescription. So that's why we have Omeprazole in the United States without a prescription now. It's still kind of expensive though if you buy it without a prescription. If you get a prescription, I'm pretty sure it'll be cheaper, but I'll have to check later. And it'll definitely be cheaper if you have insurance, obviously. It's generally considered to be quite safe, so most prescribers don't hesitate to write a prescription if you feel like you need one. But I mean, you obviously can't tell them what to do, but generally speaking, they don't really care too much. But I'm a big fan of Omeprazole overall. I believe it works, it's priced well, and it's effective. I like this medication. But this is one of the few instances where the formulation matters. Remember, this is a tablet. If you get a prescription, you'll likely get a capsule. The capsule is also available over the counter, but for some reason, you have to really hunt for it. I don't know why. But the reason why that's significant is this is a tablet and it's delayed release. Delayed release tablets have a special coating on them, and this coating actually matters, and it protects the medication from the stomach, and then it releases in the intestine. Not all medications are stable in stomach acid, so that's why it has to have that protective coating on it. If it were to dissolve in your stomach acid would chew up the chemical and it wouldn't work at all. And that means this tablet cannot be crushed or split. But a capsule can be opened and sprinkled on applesauce or anything with a low pH, something that's acidic. So generally speaking, when we're talking about Omeprazole, I want to get a capsule because I want to have that option for myself or whoever I'm counseling. I try to avoid things that can't be crushed because it seems like inevitably someone's going to try to crush it. So this is 20 milligrams. That's good. It normally comes in a 20 or 40 milligram. I'm not sure if only the 20 milligram is available over the counter. I'm not sure if there's a 40 milligram or not over the counter. For treats frequent heartburn occurring 2 or more days per week. So this is not for just your laissez-faire heartburn. One thing I was kind of shocked about here, it says this medication may take 1 to 4 days for full effect. For my entire career, I can't figure out how long this takes. Because some people will tell you it works the same day, instantly, and others will tell you it takes like a week. I don't know. And this is an important warning here. You need to talk to a doctor if you need this for more than 14 days, and I'll explain why here in a moment. So there are long-term adverse events associated with omeprazole use. It's not totally innocuous. So anything over 8 weeks is kind of the point where you need to be supervised. The package said 14 days, but unless you're a trained medical professional, you can't really make that determination yourself. That's why they put a cutoff of 14 days there. Over long periods of time, it can reduce magnesium levels in the blood and also cause issues with bones becoming brittle and leading to fractures. But on the other hand, omeprazole can stop cancer. There's something called Barrett's esophagus, which whenever you have so much acid moving up into your esophagus, the cells in the lining actually change, and they become, I guess you could say, predisposed to turning into cancer cells. So the benefits versus risk, this is why doctors exist. This is why physician assistants, nurse practitioners, pharmacists, nurses, this is why we exist, because it's not a clear-cut and dry answer for every person. You have to individualize it. And that's why machines will not replace us.